Measuring clinical attachment level in healthy and diseased periodontal pockets. Clinical attachment level is the distance from the cemento-enamel junction to the base of the sulcus or periodontal pocket. It is a critical diagnostic indicator of periodontal health or disease. We'll use clinical attachment level to equal probing depth plus gingival margin, where the gingival margin is negative if the margin is coronal to the CEJ and positive if apical. 0 when the gingival margin is at the CEJ. Use a periodontal probe to measure both probing depth and gingival margin position to calculate clinical attachment level. For clinical attachment measurements, identifying the CEJ is crucial. A periodontal probe is used to locate the CEJ by gentle tactile exploration. Note the cemento-enamel junction. Gingival margin slightly coronal to the CEJ. Sulcus depth of 1 to 3 millimeters. Junctional epithelium at or near the CEJ. In healthy gingiva, the gingival margin is slightly coronal to the CEJ, and the sulcus depth typically ranges from 1 to 3 millimeters. Receded gingival margin. Deeper periodontal pocket. Visible attachment loss apical to the CEJ. In disease, the margin may enlarge coronally or recede apically, and the attachment migrates apically. Clinical attachment level accounts for these changes. To determine the clinical attachment level, the first thing needed is probing depth, which is the distance from the gingival margin to the base of the sulcus. The probe is gently inserted into the sulcus, keeping the probe parallel to the long axis of the tooth. The tip is kept along the root surface, and light force 10 to 20 grams is used until resistance is met at the base. In this healthy example, it measures 2 millimeters. In healthy tissue, the gingival margin is slightly coronal to the CEJ. In this example, the gingival margin would be recorded as -2. In healthy tissue, the clinical attachment level equals 0, as the gingival margin and periodontal attachment are in their natural positions. In diseased gingiva, the probing depth increases due to loss of attachment. Here, the depth is measured at 7 millimeters. In diseased tissue, the gingival margin may become enlarged. The first step is to locate the CEJ. In this example, the gingival margin is recorded as negative or -4 due to inflammation causing enlargement of the gingiva. This formula is used to give the clinical attachment level in this inflamed site, a probing depth of 7 millimeters and a gingival margin of -4 millimeters equal clinical attachment level of 3 millimeters. In diseased gingiva, the probing depth increases due to loss of attachment. Here, the recession is measured at 4 millimeters. In this example, the gingival margin is receded. The first step is to locate the CEJ. Here, the gingival margin has migrated apically, and the measurement recorded is 4 millimeters. The formula is used to give the clinical attachment level shown in this disease site. The probing depth is 2 millimeters and the gingival margin is 4 millimeters, which equals a clinical attachment level of 6 millimeters. This comparison shows how clinical attachment level reveals the extent of periodontal attachment loss in healthy and diseased conditions. This emphasizes why probe depths alone can be misleading. Record probing depth and gingival margin at each site. Clinical attachment level is computed per site to guide diagnosis, risk assessment, and treatment planning. Thank you for watching. Accurate measurement of clinical attachment level is crucial for diagnosing and managing periodontal diseases effectively.